Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are doing this podcast every week with Dr. Sara Figueredo. She is the research and technical director of the institute, and she is here with me today. Hello, doctor. How are you? How you doing?
Oh, very good, Louise. Thank you so much for having me.
Today we have a very interesting topic, which we all suffer, especially me. I'm losing my hair very much. And the topic today is hair loss. And doctor, how can stem cells help people with hair loss? I know this is a very common thing nowadays, especially with COVID, right?
Yes, absolutely. Yeah, with COVID, that's just another thing that's causing hair loss, along with other various different factors that we take into consideration at the Stem Cell Healing Institute. It's really important to, first of all, pinpoint the cause. We always want to pinpoint the root cause of disease and hair loss and so on and so forth in order to address that in conjunction with the stem cell therapy. So yes, with COVID, we're finding a lot of hair loss, and once we fix the problem in terms of immunity and proper circulation, which we find is diminished with COVID and other factors with COVID, and those aren't the only. COVID's not the only reason people lose hair. Obviously, there are nutritional deficiencies, hormonal imbalances, and then, of course, just trauma to the hair follicle. So we want to, first of all, pinpoint the cause, address the cause, and stop any further hair loss, and then, of course, regenerate any damage to the hair follicles and the skin of the scalp in order to stimulate hair growth, new hair growth.
And
So that's
I'm pretty sure people are wondering how this the treatment is done. Is it locally injections, or
yeah.
do you do IV for this?
That's a very good question. We do both. We want to, like a lot of our listeners have probably heard from me in the past, that we leave no stones unturned. So it is the best approach in order to do it's the best approach to put the stem cells into the bloodstream, where it nourishes the scalp from the inside, and then we also inject locally. So we would do both. We would definitely do both. And it's done under local anesthesia so that the patient is the most comfortable, because some areas of the scalp can be very sensitive, especially the temple area and so on and so forth. So yes, that's sort of the procedure. And in terms of the stem cells, and we also, as a lot of our listeners know, we combine that with complementary and adjunctive therapies, nutritional supplements, key nutritional supplements, detoxification program with a nutritional IV of a cocktail of vitamins and minerals and antioxidants, as well as growth hormone therapy if we age appropriate and if we find that we need it, as well as oxygen therapy, which, of course, all of these are sort of helping the body to get to a point of rejuvenation even before the stem cells, and then we continue that after the stem cell treatment itself, as well as a stem cell enhancement formula, which is a combination of key minerals and herbs that sort of prepare the body and help the stem cells continue to do their job.
I was wondering if this treatment also can be done to patients that suffer from alopecia.
Oh yes, so alopecia is a form of hair loss, and And again, there are various causes, and we see it more and more in women nowadays, which we never used to see, as common in women as we did in men, with the male pattern balding and so on. So with and hereditary factors. So yes, we do address, and those are typically a lot of hormonal imbalances there, and then with a lot of women that tend to extreme dieting, we find that they start to lose their hair, and it's simply because of nutritional deficiencies, and it's unfortunate because left untreated for a long time, the follicles incur a long-term permanent damage. And so even if the right nutrients are there, the follicles aren't there in order for the hair to grow. And that's when stem cell treatments really help in terms of regenerating the follicles.
So, doctor, we also do some oxygen therapies as hyperbaric therapy. Is that correct?
That's right. Yes, we will choose whatever is appropriate for the patient. So we will do either hyperbaric oxygen therapy, or in short, HBOT, or exercise with oxygen therapy, EWOT. So, and depending on the limitations of the patient, and if a patient is claustrophobic, for instance, we won't choose HBOT. Or if we have a patient with a pacemaker or something like that, which wouldn't be appropriate for HBOT, then we will do the exercise with oxygen therapy. And most of our patients, we will do EWOT, the exercise with oxygen, because it's just a nicer, more comfortable, quicker approach rather than being 90 minutes in a closed chamber with HBOT. We can get the same job done with about 20 minutes on an exercise bike with the 100% oxygen. So yes, that's usually the approach we take with the oxygen therapy.
So going back to the treatment, we can understand that the treatment may reverse the hair loss, but when can we start seeing some hair follicles
And an actual hair growth,
and actual
that can
hair
take
growth? Yeah.
yes, that can actually take several months, because it takes time for the tissues to regenerate. And so we have actually seen some peach fuzz within weeks, but actual a difference in the thickness of the hair and the amount of hair, we see that in a few months.
So this actually can avoid the hair plugs, right?
That's right. That's right. Because what's important to remember about the hair plugs is that if the underlying problem is not addressed, we have a quick fix with the hair plugs, but the hair has a tendency to fall out again. And so if there isn't proper regeneration, and if the underlying causes aren't addressed, we see the hair plugs falling out again. And with the stem cells, it's literally a reversal of time, and a reversal of the hair loss, and renewed hair growth, regeneration. So it's like starting from the beginning again, and it's uh, like a rebirth of the hair follicles and the hair itself. And of course, like I keep reiterating, that it's really important to address the underlying causes.
Okay, doctor. So these treatments, I understand, are done right here in Guatemala. And why is it in Guatemala? Why did you choose this country? I understand you were from Canada.
That's right. Yes, yes. So I'm Canadian, and I practiced many years in the U.S. With stem cell and regenerative treatments, and the primary reason that brought me to Latin America is that these types of treatments are restricted in the U.S., and they're literally just not allowed. Combining stem cells with other cofactors, like such as growth factors from your own blood, it's considered illegal to do in the U.S. Um, we can't do certain treatments with the stem cells. We can't use stem cells from other sources other than the patient's own body, which can be very, very safe and effective depending on the disease or the condition being treated. So there are many, many restrictions in the US that actually inhibit good results because of that. And so that is why I'm practicing in Guatemala. And so number one is the law and the regulations that allow us to have a broad scope of practice with stem cells here in Guatemala, and it's safe and legal, and as well as the fact that the standard of care and the caliber of care that you get here, we can keep prices ethically priced because of the fact that we're in Latin America. So it's sort of a win-win situation with the treatment here, and with the treatment we also include accommodations and a driver, which makes it very easy for patients to come down. And so yes, and of course Guatemala, as you know, Louise, it's a destination spot with the Mayan ruins and the volcanoes and coffee farms, and so it's a beautiful place to visit. I think it's very underrated.
Yeah, and we can also arrange with local tour operators in case patients want to go and do some sightseeing or visit some of the main attractions here in the country.
That's right.
So, Doctor, is there anything else you would like to add to this podcast?
I think that's it. We can let our listeners know where they can find us on Facebook and Instagram, as well as our website at www.stemxcure.com or stemcellhealinginstitute.com, as well as our YouTube channel. And what am I missing here,
The
Louise?
phone number, you can reach us at also by WhatsApp, and the number will be area code 502, and the number is 4220 7297. And if you want to call us from the US, that will be +1 209 690 7836.
That's right. That's right. And we also have other podcasts on Spotify and Anchor.
That is correct. And if you like this podcast and you wanna recommend the podcast, you can find us as Stem Cell Healing. That's how you can find us on Spotify. And also, if you want to listen to this podcast on a video format, you can find us at YouTube under Dr. Sarah Figueredo. That's what it's called on YouTube.
Great. Thank
So,
you so much, Louise.
thank you, Doctor, and see you next week. Talk to you next week.
Yes. Have a beautiful weekend.
You too. Bye bye.
Okay. Bye bye.